Indeed, let's talk. It's just gone 6 o'clock across the capital. Sashel here, taking over from the Drive Time show with Karim Battar because I am bringing you a very special monthly panel show in conjunction with Brent Council. This is the Brent Health Matters program. Now, this is where we have an honest chat with people that have got lived experience of a particular issue, and of course panelists. We always have an amazing panel, people that have got so much knowledge in the area, because what we want to do is speak about issues that are very, very important to our community, raise awareness, and make sure that you are definitely informed of what you need to know about certain situations. But this week, we are bringing you a very special panel show. It is about sickle cell. Now, this is something that I know you would have heard somewhere, whether it's your friends, whether it's your family, whether it's your grandparents, whoever it is, you would have definitely heard of sickle cell. And there are definitely loads of initiatives across the board, across the media, that are trying to raise awareness on this. So today, this is a very, very important conversation. We're going to keep you company for the next hour talking about sickle cell. And if you want to get in touch, please hit us up on the socials at the Beat 1036 FM on Facebook, Instagram, and Twitter. If you've got questions for our panelists, do let us know and we will definitely pass them on and make sure that they get answered. But let's start by introducing the panel. And today we have got an incredible amount of knowledge. I want to start off with Dr. Kofi Ani. Dr. Kofi, are you there? Can you hear me?
Yes, I can.
Thank you for joining us this evening. Thank you for your time.
Thank you for being with you. Thank you
Of
for the
course.
invite.
Of course. Would you mind just quickly giving us a very short summary of who you are, where you work, and what you do?
So I work for one of our NHS trusts locally. It's called the London Northwest University Healthcare NHS Trust, but it basically three main hospitals: Central Middlesex, Northwick Park, and Ealing Hospitals. And I work as a psychologist primarily with people who have sickle cell in their families, but also work with another group of patients who have, and their families who have thalassemia.
Okay, and we will talk a little bit about that in a little while. Keisha, are you there? Can you hear me? We've got
I
Keisha.
am. Can you hear me?
Hello. Yes, we've got Keisha Osman Joseph. Keisha, would you mind just giving me a very quick summary of who you are, what you do, and just about your experience?
So my name's Keisha Osman Joseph. I'm a nurse consultant for hemoglobinopathies, which is sickle cell and thalassemia. I work for the same trust as Kofi does in Northwest London. And my role is overarching operational and strategic, looking after the service and the staff that manage the staff that run the service at London Northwest. So looking after a big number of sickle cell and thalassemia patients from the London Northwest area.
Amazing.
I have been a nurse for over 20-something years and have basically been looking after patients with sickle cell and thalassemia since I qualified over 22 years ago. So from antenatal pediatrics transition and into adult care.
Amazing. And I just want to talk to you now, Fiona, just very quickly. Now, not only do we have panelists who have got a very medical background, who are very, very knowledgeable about the topic, we talk about people that have got first-hand live experience. Fiona, would you mind just giving me a very quick summary of what you do and, you know, your experience with sickle cell? You're on mute, Fiona. Can't hear you. Can you hear me? I think she's just on mute.
Good evening, everyone. Can you hear me now?
Yeah.
Awesome. Thank you so much for this opportunity. My name's Fiona. I'm a sickle cell patient, a volunteer, a patient advocate, and a facilitator. As a patient, I was diagnosed quite early at 3, and I suffered a lot as a child. But as I grow older, I tend to have less crisis than when I did. And because of the type of sickle cell that I have, I do have a lot of other issues associated with it.
So you've got some lived experience of sickle cell. We will get into that very shortly. And you're also an advocate, aren't you, for sickle cell? So we will talk about that a little bit further. But thank you so much for joining us this evening. And Lorraine, can we just talk to you a little bit? You have got a very close relationship with sickle cell as well, haven't you? Can you just tell me a bit about that?
Yes, I'm Lorraine Airy. Good evening, everyone. Thank you for inviting me to the show. So I'm the mother of or carer of one that had sickle cell. So my son Tyrone Airy died on the 17th of March 2021. So I have experience of what it's like to watch someone go through sickle cell the way that he did, and I'm wanting to make sure that there's some improvements and changes in sickle cell.
Of course. Thank you so much for joining us. And I will kind of come to you and speak a little bit more about your son and your experience as well. But just firstly, just for our listeners, for those that don't know what sickle cell is, Dr. Kofi, would you mind just talking to me just a little bit about what sickle cell is, and just kind of how common it is?
So sickle cell basically is an inherited blood condition. And basically, when we look at sickle cell from the point of view of how it, in a medical way, affects people, it's simply that the affected person would inherit one gene for the sickle cell from one parent and another gene from another parent. The bit of the red blood cells that is important is what is inside the red blood cells. We call it hemoglobin. Basically, it's what gives red blood cells the red color. So if you inherit two genes, one from each parent, then what tends to happen is that, usually our red blood cells are round and soft and quite flexible in shape. But with the sickle cells, that shape would change under certain conditions to become, the shape of a farmer's sickle. And that's how it got its name. But the shape is basically like a crescent, moon-shaped or something like that. But unfortunately, those cells then are not as soft, round, and flexible. They become hard, sticky, and they tend to block our blood vessels. And in so doing, the flow of blood cells, including the usual soft red blood cells, can't get through the very small blood vessels. But if you think about it, blood cells are all over our bodies, and blood cells are also all over our bodies. So we tend to have this blockage. And one of the, sort of hallmark symptoms of this blockage of blood vessels, because the sickle cells are hard, sticky, and can't move around, is what we call a vaso-occlusive crisis, or crisis for short. So usually when people are in pain, as a result of sickle, we refer to it as crisis. But also, there might be other complications, and that can range from, anything that affects any major organ or any part of our body. So apart from pain, if you think of any of our organs, like, our brain, our kidneys, our liver, our spleen, all those can be affected. And unfortunately, it causes a lot of complications, apart from pain, for which, treatment is required.
Right. Okay. And you mentioned thalassemia as well.
Yes.
Could you just give me a little overview of what that means?
So thalassemia, in a way, is similar to sickle cell from the point of view of inheritance. And so with thalassemia, you also inherit a gene from one parent for thalassemia and another gene from another parent for thalassemia. If you inherit those two genes, you tend to have a bit of a problem in terms of the amount of red blood cells that are produced that are sufficient for somebody to live properly. So, and sometimes, depending on the type of thalassemia that you inherit, you'd probably need transfusions for life. So that's the bit that we worry about a lot. But also sometimes you can actually inherit one gene for sickle cell from one parent and another gene for thalassemia from another parent. Okay. But when you combine the two, because you have the sickle gene, we tend to sort of refer to it as being a type of sickle cell disease.
Right. Okay.
So some patients might have inherited in that fashion, and hence they have that type of sickle cell disease.
Okay. And is it quite common? Is sickle cell quite common in the UK?
So sickle cell, I would say, in terms of the UK, it's not very common.
Okay.
We have roughly about 15 to 17,000 people with sickle cell in the UK. So that is a very small number. But obviously, if you look at it globally, in terms of other countries, in Africa, for example, you'd have the highest numbers in Africa, but also in places like the Middle East, the Mediterranean countries, Arabia, and also the Asian continent, places like India. So primarily, those that are affected by sickle cell disease in the UK tend to be from these kind of countries by origin, and therefore Black and minority ethnic populations are mostly affected in the UK.
Okay, that's good to know. Thank you for giving us a little bit of context there, because some people may have heard sickle cell and not actually know exactly what that means. I will come back to you, Dr. Kofi. Just quickly, Fiona, I just want to know from your experience, based off of what Dr. Kofi said, would you mind just talking to me a little bit about what you felt and how you basically dealt with your sickle cell?
Certainly. I have to say, when I was a child, it was harder, mainly because I grew up in the Caribbean and there wasn't enough information out there. So by the time we did have a consultant come out there, it was like a godsend for me. A crisis, typically, when I was younger, would come on anytime. And I wanted to have a normal life just like everybody else. Unfortunately, I could run around. It could trigger for crisis.
Wow.
Not drinking enough water to keep myself hydrated. That could trigger for crisis. Stressing could trigger for crisis. And when that happens, as a child, it literally means I'm in this type of pain where it feels like someone's constantly stabbing me.
Oh no.
And it doesn't matter how much my family tried to console me, before we knew there was some form of treatment or things to do when you were growing up, I would be in that pain and always rushing to the hospital. But as I got older, I was able to manage it based on some really good advice that I had. And it's basically try to get some exercise, eat the right type of foods, and to be happy. But seriously, we thought things like eating beetroot every day would help your blood cells grow. But that's a myth. The amount of beetroot you would need to eat, you'd probably buy out the entire shop.
Wow.
So your diet basically consists of a lot of greens. And when you grow up in the Caribbean, we didn't have spinach. What we had was a vegetable called callaloo. So it was eating a lot of callaloo, eating a lot of liver and kidney and green beans and any other green vegetable to kind of help us. The pain would only ease once I've been given pain relief. So just imagine a child constantly on pain relief for a long time of their life until they learned how to manage the crisis. And at the time, we didn't know how much water you're supposed to drink. So it's constant drinking lots of water, keeping yourself hydrated, keeping yourself cool and resting.
Right.
So that's the experience that it was for me. Now I'm older, I can do a whole lot more to help myself. So that
Okay.
includes definitely getting some form of exercise, even if it means get up and walk around the room. Being outside, getting some fresh air, eating the right foods, and just generally be happy.
So are you saying then that in your experience, things like, diet, exercise, drinking water, and medication are the treatments that helped you to kind of manage yours?
For me, yes.
Okay.
No two person are the same. Others will require other things, like making sure that we're on antibiotics, that you're getting treatment, you need oxygen. But as I got older, oxygen was introduced into my life when I have a crisis.
Okay. Wow. And it sounds like it's just so it sounds extremely painful, and it's like, as a child, for you to go through that, my heart is just with you, because how do you explain that to a child? How do you tell a child that this is what's happening and this is why it's happening? I suppose there are loads of people here in the UK that have got friends and family and other people that they know that have maybe got young children. What would you say to them if they're kind of going through that? What advice would you give based on your experience?
I would say to them, you need people around you. A lot of families that I've had interaction with, they don't have that support. So they are alone in their journey. And we're not being given enough information about our diet. And that is something that I would impress on families. Do some research, speak to your consultants, ask them what you can do. The cold weather is a big factor. That can trigger off a crisis. I've been having minor ones for the past couple of weeks. So that literally means me being in bed and taking the best medication there is. Don't sit down and stress so much. Ask for help. There are places you can get help, like the society. Um, find groups, join them on whether it's Signal or Instagram or Facebook, and ask other parents, how do you help your children?
Yeah.
Because they can't go out and run around like most people.
Mm.
But you'd be surprised what people can do, the amount of information other parents have. The consultants can also give you some really good advice. Speak up, be strong, and as I say, the things that helped me was the diet, the exercise, and be happy.
Yeah.
And there are booklets out there that you can get as well that gives you more advice
Hmm.
on how to help your child's journey with sickle cell.
Okay, amazing. And you're doing, loads of advocacy work as well, which we will get into in a little while. Keisha, I'm going to come to you next, but just quickly, Dr. Kofi, can I come back to you? Because Fiona was briefly talking about, the type of things that helped her manage her sickle cell. Could you just tell me, if there are adults and children in the borough and just across the country with sickle cell, where do they go for treatment and care?
So the organization of care has changed a bit recently. But basically, let's say if you're in Northwest London, there are, a group of hospitals that have come together to provide care. So depending on where you live, and this will apply in other parts of the country, we have what you call specialist hospitals. And we also have what you call local hospitals, which have come together under a designation by NHS England to provide care locally and in specialist centers, just to make sure that everybody has a certain level of expertise in terms of their care. So basically, that's how the care is organized. And if you take Northwest London, for example, we have 9 hospitals, but we also have community centers which come together in this sort of area as a network to provide the care. But our network is actually quite a wide network in terms of the geographical area by designation, and it's Northwest London and Southwest London. But if we just take Northwest London, if somebody's local, then some of the hospitals that I've already mentioned, Central Middlesex, Northwick Park, Ealing, but we also have Hammersmith, Charing Cross, St. Mary's, we have Hillingdon, we have West Middlesex, we have Chelsea and Westminster, and so on. So it's a whole sort of network of hospitals that is in a way in our network come together and making sure that the organization of the care has specialists across the board.
Okay. And then Keisha, just quickly, I wanna come to you if that's okay. We were just talking. I was just talking to Dr. Kofi about where to get treatment and how that kind of works. But before all of that, is there somewhere that someone can get tested to see if they've even got sickle cell in the first place?
Yeah, so you can request a special test from your GP. It's called a hemoglobinopathy screen. So you can request that on HBO screen because hemoglobinopathy is a bit of a mouthy word. So on HBO screen, if you would like to be tested, or maybe you believe that, or you're aware that sickle cell runs in your family and you want to confirm, you can request that from your GP. In addition to that, there are centers throughout the UK where people can walk in or contact the center to arrange a blood test. There's a list of the centers throughout the entire UK on the Sickle Cell Society webpage. So you can find something that's local to you. And if there's none in your area, then you can go to your GP. We have an antenatal and a newborn screening program that's linked in the UK. So all women during the antenatal period are tested anyway, and all babies are screened on day 5. And so at some point, but if you fall outside of that, if you're new to the country, or maybe you're not quite sure what your genotype is, you can arrange that, request that HBO screen from your GP, or check the Sickle Cell Society website for a list of centers and try to identify one that's local to you.
And I know you mentioned that, if you think it may run in your family, this might be a reason why you'd go to the GP and get a HBO screening. But are there any other reasons why are there any particular kind of symptoms or pain, or that if you feel like that, then you think, actually, do you know what, maybe I should go to the doctor? Is there anything in particular?
That's a good question. When we run an HBO screen under the microscope, it can look very similar to iron deficiency anemia. And so sometimes when the report comes out, it's from the lab, it tends to say something similar like iron deficiency / possibly thalassemia. So if you're struggling with things like lethargy, extreme tiredness, find it difficult to get out of bed in the morning, and this has been ongoing for a while, then I would recommend your GP running an HBO screen to identify if there's any sort of red cell condition that could be contributing to that, but also to test your iron scores. This is the hemolytic, so this is going to test for your folate or folic acid levels, your ferritin levels, and your vitamin B12. And then we can differentiate whether or not it's iron deficiency anemia, and we can provide some supplements to correct that, or if actually you have some sort of hemoglobin, you might be a carrier of something that may be contributing to it.
Okay, that's really useful. Thank you. And I suppose you mentioned, when babies are born, I think you said 5 days, they get a screening to kind of test for this. What about for couples or people that are planning a pregnancy?
So for preconceptual couples who are not yet pregnant, and if they're aware of their genotype, they've already been tested, we can confirm that they're both carriers. The NHS recommends or provides access to what we call pre-implantation genetic diagnosis, or PGD. This is available for couples who we know are already at risk. They would have to see a specialist counselor or a specialist midwife who can then refer into a specialist clinic. For London Northwest area, our specialist clinic is based at Guy's and St Thomas's. So what PGD actually does, it uses the IVF technique by selecting unaffected embryos and then planting one back into the woman. So we avoid an affected birth. There is a criteria that couples have to meet. Women have to be, a certain age, particular BMI, but all these sorts of criteria and discussion would happen in consultation once a referral is made to that specialist center. So that's if if you're not pregnant yet. If you're already pregnant, I mentioned about the antenatal screening program. A woman would be identified during that program. So she'd be having lots of other blood tests done, and we also test for sickle cell through that program. Her partner would be offered screening, and then if we then confirm that they're both carriers, so they're at-risk couple, we can offer prenatal diagnosis. So this is where we take a sample of either the placenta or the fluid around the baby, and we can identify through DNA technology the exact genotype of the baby that the woman is carrying, which is always very good. There's a 1% risk of miscarriage with this test, I have to say, and that's always, discussed with the couple at the time of doing the test, in consultation with them. And then, couples have an opportunity whether or not they want to continue the pregnancy or not. And then the other option is just no further testing, continue on with the pregnancy. If you're an at-risk couple, there is a 1 in 4 chance or 25% chance that you'll have an affected birth. So it means that 75% chance, your baby would not be affected. So these are the options at the moment on the NHS.
Okay, thank you. And just on that, before I come to you, Lorraine, are there any kind of common myths or misconceptions when it comes to sickle cell, in your opinion?
Yeah, I think the ones that come up a lot are life expectancy, which is very variable. We have data, we have old data. So part of Kofi talked about the structures and our HCCs collecting data is to see where our patients are in the country, what sort of complications that they normally experience. And we're looking at, how that affects their care and their outcomes. So the old data we have from many, many years ago gives an average age for a patient with sickle cell disease, the most severe type, around 42 to 48. So 42 for men and 48 for women. But there are centers and there are patients out in the communities who have sickle cell disease who are hitting 70, 80. I've met a 90-year-old patient with sickle cell. So it's very variable. So that's one myth. I think when patients come into hospital, I'm sure we're going to talk about this a little bit more once we speak to Mrs. Airy. This perception about patients drug seeking and possibly dependency, around having to use opioids for analgesia. And that's a very deep topic. It touches on a lot of things, including people's perception about pain, people's perception and maybe conscious bias. We have a document, the No One's Listening report that came out in 2021 that clearly identified racism as an element of, or relating to or contributing to poor care. Another myth is about maybe poor quality of life. Not all our patients have poor quality of life. It depends on how the condition affects people. As I mentioned, I've cared for patients who are in their 90s with sickle cell disease. Everyone, how sickle cell affects each patient is very variable. So those are kind of some of the things that, these are the ones that come up a lot that I get asked questions about when I'm doing teaching.
Okay, really useful. Thank you for highlighting those. Lorraine, I want to come to you if that's okay, because I just want to talk to you a little bit about Tyrone. Could you just start off by telling me just Tyrone's story? You know, when did you find out that he had sickle cell, and just kind of talk me through what happened?
So I found out Tyrone had sickle cell when he was about 3 or 4, just being in a lot of pain. And you can't see anything. There's no swelling or anything like that. Taking him to a children's hospital at the time, Paddington Green, which was kind of good that there was a dedicated children's hospital that he could go to. And as a child, he would be in hospital maybe 3 or 4 times a year. You know, sometimes the pain would come on quite suddenly. Other times you could tell that he's in a bit of pain but doesn't want to say because he didn't want to go to hospital or something like that. I think when he was still in the children's hospital when they said that they believe that, you know, he's not in any pain, he's just addicted to morphine. You know, and I was quite shocked kind of, you know, to hear about that. And I think because Tyrone was 46 when he died, so we've been in and out of the NHS for over 40 years. Especially in those very early days, there was no information, you know, no real support. The Sickle Cell Society didn't even exist at that point. And yeah, and I've just found that it's been a continuous learning curve, but also a continuous lack of knowledge sort of continuum as well. So things like trying to find out what would trigger a crisis, you know, in the early days just had no idea. But then, you know, as through trial and error in a way, you know, going on holiday and Tyrone, you know, wanting to be in the sea and he goes into the sea and then he's ill on holiday, that kind of thing. So then we realized, you know, cold, he can't, you know, go through like extreme temperatures and things like that. So it was quite tough, and it was just a huge shock to know that 40 years later, and having been in and out of the system, that you could go in, you know, with these little bag hoping to come out, you know, after a few days or something, and then to know that he didn't come out because of, you know, the care that he received. So that was, you know, quite a huge shock. I mean, he did travel a lot, so even though they talk about oxygen and things like that, I could see that when it comes to having like heat, I guess all the way through to his bones in a way, it's like the heat just hit different. So you know, he did travel and things, which was really good. And I used to try and just get him to live as much a normal life as possible. So even, you know, he might have a job and then he's ill and then he loses the job and stuff like that. But being quite a handsome and charismatic boy, he would quite often get other jobs as well. And I realized that sickle cell did make him quite angry, you know, and frustrated because, you know, the kind of stop start, I think, of sickle cell. And I didn't realize actually till he passed that, you know, the psychological impact and, you know, that part of it is not actually really addressed. But I was pleased to hear Fiona saying, you know, one of the things that, because I didn't know about diet and things like that, although, you know, I believe in healthy eating. So, you know, probably doing the right things, but not realizing it's, you know, those things that are helpful. But very pleased to hear Fiona say, you know, being happy is important. So that's the one thing I used to always try to impress upon Tyrone is do what makes you happy. You know, be happy, you know, as much as you can. So when he discovered music, you know, as his passion and became a singer-songwriter, you know, that really did you know, lift my spirits. You know, I really felt that in my heart that he found, you know, a passion that he liked, that he could do when he could do it, and something that, you know, no one could take away from him. And, you know, he was pretty good at it.
Absolutely. And I mean, this must have been really tough for you as his mum. I mean, did you have support around you? Did you have, I know you said the Sickle Cell Society wasn't around, but did you have anything to kind of help you understand or help you to just manage?
No, not really at all, actually. It's always been a very, very, very lonely journey. I didn't even have another parent, with a child that had sickle cell around. My family didn't really know it, didn't know anything about sickle cell. So, and in the early days of the Sickle Cell Society, as a small charity, there was a limit to what they could do and what they could offer, as well as, it's grown a lot, but no, it's always been a really lonely journey. And for Tyrone as well, because I don't believe that he really knew anyone else that had sickle cell either. So it was quite isolating. And no one understanding it. There's all, like you say, all the misconceptions go around, that, he's ill because of this, malnourishment, ill treatment, this, that, the other, because people don't understand, the debilitating nature of the illness and also the psychological effects of it as well.
Of course. And I mean, obviously hindsight is a very powerful thing, but I mean, do you feel like there was anything that could have been done to maybe prevent it or manage it, or do you just feel like, it just is the journey that you have to just go on and take it as it comes?
What do you mean in terms of what happened to him, or
Yeah, but in terms of what happened to him.
what happened? Tyrone he needn't have died when he did. That's the fact. So yeah, I think, better care, because negligence contributed to his death. I couldn't understand how the negligence could be quite blasé, but yeah, I think, yeah, if he had had the care that he should have received, then he potentially could have still been here.
Yeah. And that's just horrible to even think about. I mean, I can't even begin to understand what you must be going through, and I suppose what would you like to see? I know you said you would like to, see care be improved, but is there anything in particular that you think needs to be changed when it comes to this? So, there isn't another Tyrone situation.
Yeah, I just think, like I say, the most shocking thing is, 40 years on, we're at the stage where there's still a lack of, knowledge and awareness around sickle cell. You shouldn't have gone in and within 24 hours, be dead. So I'd like to see just more awareness, around the hospitals, because I have talked about things like bank staff. How do you keep staff trained when you've got lots of changes of staff all the time? But I do think that all staff in all wards in the hospital should have an awareness of sickle cell, because someone can come in and have a crisis at any time. So it's not just about the dedicated sickle cell wards, about all of the hospital care. Because as with Evan Nathan Smith, who died at 21, dialing 999 from his hospital bed, wanting oxygen, which was being denied to him. He had a crisis in a ward that didn't know anything about sickle cell. So that's one thing for sure. And the training needs to be constant and ongoing. So that's why I'm trying to remain really visible, because I'm to try and to make things sustainable rather than a stop start. Okay, we've done that now, so off you go. Just to make sure that things are sustainable. I would like for staff to. I would like for the attitudes to sickle cell patients to change. I hear a lot about the clinical things that get done, but I don't hear enough about the behavioral side of things.
Mm,
I've heard conscious bias, but I think there's also unconscious bias, and this kind of knee-jerk reaction when someone is not manageable. You know, it's like I've seen it too many times where Tyron's expected to sit, you know, with his hands in his lap and you know, and be a good boy when he can't cope with the pain that he's experiencing, and I can't do anything about it, and only the hospital can. So I am working with NHS England, London region, you know, part of their steering group, and
mhm.
so you know, one of the, you know, we've now started working with the behavioural science team because I think any kind of training that's put in place, that the behavioural aspect, you know, needs to be considered. And, you know, maybe the clinical staff, if they don't have that training, you know, that might affect how they treat a patient. So that maybe they just need, you know, sort of extra help.
Mm.
Um, so, yeah, I think the training and making sure that, you know, the information is there for whether someone comes in as a temp
Yeah.
or
They
whatever.
just kind of know how to handle it. And if they were to, someone was to have certain symptoms or kind of just be able to see, if does this person look like they might be having a crisis? I can manage that. I can deal with that until we can get a specialist in. And it's hard because, when you think about situations like Tyrone's or even yourself when you were going through that, it's like, where was the support? Where there's still a stigma attached to sickle cell amongst a lot of other things in particular communities. There is still a stigma and there was still a lack of understanding, and that's the reason why we have these conversations, and this is the reason why we will put resources up on our website so people can do some more reading, because it's the responsibility of everyone. Even if you don't have sickle cell, someone might have sickle cell, someone that you see on the street might have sickle cell and then have a crisis. The more people that know about this, the more we can help each other, and we can support each other if we need to. And people won't need to feel lonely like you did, Lorraine. People won't need to feel like there's no one that understands and no one that knows about this. The more we spread awareness, the more we can try and make a difference. So I'm sorry you went through that. I really do apologize that you went through that. And I really hope that now there are people around you that can try and support you a little bit more than what you received back then. And I will come back to you, Lorraine. But just quickly, Fiona, I want to pick up with you because Lorraine mentioned that the Sickle Cell Society wasn't around back then. Can you just tell me a little bit about the Sickle Cell Society? Because I know that you kind of advocate and do some work with them, don't you?
Yes, so the society is actually the only national charity that covers the UK on sickle cell. The staff are amazing, but they all work part-time. So what they do is basically set up the site so that they can share information. They have many charities that other people have formed, and support groups or support networks that they can share information with. Now, I've been a member of the society for a while, and it's usually patients who want to, or members of family of patients with sickle cell who wants to be a member. Now, the CEO, John James, travels in and out of London a lot. And one of the things he's focusing on is finding centers who are able to support individuals with sickle cell, share information about what they're doing in Parliament, how to support children and other families, as well as information about medication that's coming about. His work isn't easy. And every charity needs financial support.
Mm.
Working for them on a voluntary side has been amazing. It's educated me. It's given me an opportunity to go out and spread awareness about sickle cell. We talk about one of the treatments out there, which is blood transfusion. We try to get people to sign up to become blood donors because there's a vast need. Last year, the NHS posted on Instagram and social media and TV that we need about 40,000 people to become blood donors, especially from the Black and Asian community. We go to a lot of places. I've been to so many offices and events to try and spread awareness. We also talk about making sure people get tested for it. So we often get this thing, oh, it's only Black people that has it. That's no longer true. We talk about intermarriages and the fact that it's no longer about color, sickle cell. It's important that we understand that it is an illness that doesn't have a lot of treatment like some other illness out there.
Yeah.
We don't get enough support because, again, I believe it's because they think it's mainly Black people who has this.
Right.
The more we start sharing information and say it's no longer about color, I think people will start to step up. So I've been to theaters. There are others who go to gyms to sign up people to become donors. But we also say to them, if you were born before 2006, you wouldn't have been given that option to test your child to see if they have sickle cell. And I would recommend that you go and test to see if you have it, or if you've got the trait, or if you're planning to have children, it's an option for you to go and get tested just in case you have the trait. We also advise individuals that if you need to do more, do some research. Speak to your GPs. If you've already got sickle cell, speak to your consultant about planning a family.
Yeah.
There are other treatments that are new, and we advise you to speak to your consultant about trials, about how best to help yourself.
Yeah.
Now, unfortunately, there isn't enough information about diet, and I think that is something that should be forefront of every consultation that you have. Am I doing the right thing to help myself?
Yeah.
It's a big topic that you have to drink water, and we're told you have to drink 3 liters of water a day as an adult. That's very hard for anyone to do. And I can specifically say that I never get through 3 liters of water a day, but I'm constantly drinking. The society, a lot of people might think that they don't know enough, but until you have a conversation with them, you won't actually know how much they do.
Yeah, and you said it's volunteers as well, didn't you? So, obviously this is people taking time out of their own lives to kind of work for the Sickle Cell Society and try and spread this awareness. But I thought it was really important that you were saying, some of the take homes that I thought were quite important were, to get yourself tested just in case there is a possibility, make sure you are looking after yourself. And of course, I just think it's very important that we make sure and we keep saying, if you can, go and check if you can be a blood donor. Go and check, because you can help save so many lives. And I know people that go and donate blood. There are centers across the country, where you can go and donate blood. And I think that is probably one of the key messages that I think our listeners need to really understand. If you can, go and donate blood. Of course, there are reasons why some people can't, but just see if you can, because for me, I feel like that is, if we want to help and we want to support, that is crucial. There are always calls saying that we need blood from ethnic minority backgrounds, and people need help in finding a match. Let's all pull together and see if we can provide that help. Fiona, I will come back to you. Thank you. I'm just conscious of time. The conversation, there's so much to talk about that I'm just conscious we're running out of time. Just quickly, Dr. Kofi, I want to come to you as a consultant psychologist. Lorraine touched on it very briefly, What psychological impact does this have on someone that's got sickle cell and maybe the family or friends of someone that has sickle cell?
I think it's a very important issue. For a long time, people didn't really realize that, the emotional component of something like pain, for example, if you have sickle cell, is a big deal. But I think overall, we have to understand that something that has a big impact, like sickle cell on you physically, is also going to emotionally affect you. So even apart from the pain that you might experience with a crisis and having to deal with it, and also having the emotional aspect of it, but it's all the other stuff, coping with it on a day-to-day basis, and that really would affect you from the point of view of your mental health, more or less, in the sense that you might have mood changes. Sometimes you might be anxious. Sometimes you might have a low mood. Those kind of things. And I think it's generally from the fact that living with such a burden, psychological burden, and this affects people right from childhood through adolescence and into adulthood, because it's a chronic condition that is not going to go away.
Yeah.
And so having that support is very important.
And what psychological support is there? I know, of course, you are
So,
a psychologist.
So we don't have enough.
Okay.
I started working in South London, actually. I worked at King's College Hospital. I worked at St. George's Hospital. And then moving over to this part of London, Northwest London. I would say over the years, people have acknowledged the fact that psychological support is important and is required, but we just don't have enough. We don't have enough psychologists working in the field to be able to support all the people affected.
The demand, yeah.
There is some, and we have a UK network of psychologists talking to each other and trying to make sure that we address the issues. But if there are not enough people on the ground, there is a gap.
Of course. And just on the topic of the whole psychological burden that this has, understandably a lot of it could be because people are maybe worried or concerned about treatments and cures and things like that. Just very quickly, because I'm conscious we've only got 5 minutes left, are there any kind of potential cures or any treatment or anything that could kind of be a breakthrough for sickle cell?
So in recent times, we might have heard announcements about gene therapy, for example, but historically we haven't had much. We've had obviously transfusions are required by a significant number of people. We also had a fairly old drug which has been around, and some sickle cell patients have been taking it for almost 30 years. It's called hydroxyurea or hydroxycarbamide. But for some time, bone marrow transplants with stem cells have been available for children as a curative therapy, but also in recent times available for adults with a certain criteria. And also gene therapy recently approved by the regulator, but it still has to go to the NHS body that approves it for NHS England to, let's say, we are going to fund it. So there are some things in
the pipeline,
as well as new trials, but as well as
something
that is possibly another option for curative therapy. Yeah.
Thank you. So there is hope. There are things happening in the pipeline. Yeah. So let's just see, with research and funding and all these kind of things, let's see what technology can do. Just before we head out, I just would like, just because you've been so amazing, just as a panel, just one take home for our listeners from this kind of session that we've had where we've spoken about sickle cell. Keisha, I want to start with you. If you could tell our listeners to take home or take away one thing from this panel discussion, what would it be?
I think you guys touched on it. It's really to get yourself tested. to find out whether or not you're a carrier or not. And also to see whether or not you can give blood. I'm going to reiterate what has been said before. We really need donors from the Black and Asian community. I know we've got a couple of minutes that we need to finish, but I just wanted to mention about a new program that's being rolled out at the moment with the NHS Blood and Transplant Service, where we're going to be matching via DNA, very closely matching all the patients with sickle cell disease. What this is going to do is reduce any risk of them having complications or developing antibodies, because we know that most of the donors come from a white population. Hence us, the big ask is for people from Black and Asian communities to donate. So get tested, donate blood.
I love that. Keisha, thank you. Fiona, just very quickly, we've got 2 minutes left. Just one take home. If you could say one thing to our listeners to take away from this panel discussion, what would it be?
Please be open and ask for help. There's a lot of support out there. Do some research, go on the Sickle Cell Society website and speak to people about it. If you need help, there's a lot of people who are very patient and understanding and willing to help.
Fantastic. Lorraine, very quickly, if people could take away one thing from this, what would it be?
Each one teach one, talk about it, so that people understand whether they have sickle cell or whether they can be a support or a carer, even things like talks at your workplace, so that people just understand, more about it.
I love that. And Dr. Kofi, would you mind just very quickly giving us one take home that you'd like our listeners to take from
Just
you?
say stigma is a big thing, and it encapsulates a lot of things that we've discussed, especially the stuff that Lorraine talked about. But I think it is based on lack of knowledge and lack of understanding. So we need to address stigma, and starting within our own communities, understanding sickle cell, making sure we don't stigmatize people, and also within the health service system, making sure we try to address that as a big issue.
Fantastic. Thank you all so much for your time today. This has been such an informative discussion and quite a necessary one, and it's something that we really need to make sure that we do continue spreading. Please, we will put some resources on the website. So if you need support or you want to look into it a little bit more, please head over to our website at the Beat London for more information. And just thank you so much for your time. I really appreciate each and every one of you. Take away just important values when it comes to sickle cell, things you need to do, research, understand, and really try to support the community. And that is the final thought from me. This has been a Brent Health Matters in conjunction with Brent Council. We are talking about sickle cell, and we've got Afro Beats coming up next.